the hygienist has to pre-appoint the hygiene patient. This crap where they do an hour cleaning, the whole time they're talking about themselves, my baby, what I'm going to do for Christmas, Easter, and my birthday. And it's me, self, me, self, me, self. And then when they're done, they walk up from the chart and say, okay, I'm done, check her out. And now it's the front desk fault. Now, if you got two hygienists and they both see 8 people a day, and one pre-appoints all 8 people a day, your back door is closed. You're like the Hoover Dam building up a river. And then the other hygienist, she saw 8 people. She only pre-appointed 4. She's losing half your practice one day at a time. And nobody wants accountability. They're like, they want to blame it on the front desk. No, you're in here for an hour. And the way I'm going to measure you at the end of the hour, did you provide a service that was so good that they pre-appointed to come back? See, that's all on you, the hygienist. That's not the office manager's fault. It's not the assistant's fault. It's not the doctor's fault. The hygienist pre-appoints, and if she can't get, it's like a quarterback in the NFL. I mean, obviously, there's only one Tom Brady. Obviously, some of you can't get a perfect employee. The only perfect person I've ever met in my entire life was me. Other than that, I don't know if there's anybody perfect. But my gosh, if one hygienist was always pre-appointing 7 or 8, and another one was 4 or 3, then that's a teachable, coachable moment, or you got to trade them out. That's the person running off half your practice. What do you think about pre-appointing?
Absolutely. I totally believe in pre-appointing appointments. Our patients they know before they leave the operatory, they're going to get an appointment. And the hygienists love it here too, because they can put the patients where they want them. And the patients get to the time they want, 6 months out, 3-4 months out, whatever their recall is. And so it's a great thing. I highly believe in pre-appointing your patients.
And plus, when I grew up, there was only 3 channels, and I got out of school at 3:30, and at 4 o'clock was Batman on the same Bat station, on the same Bat channel, on the same Bat time. It was KAKE Channel 10. I'll never forget. So I don't care how many hygienists you have. I want to see you the next time I come in. So you're my hygienist, and I'm going to pre-appoint with you, and this is their following. How long, the hygienists we have now, how long have they been here on average?
I believe one 13 years and one 14 years.
Yeah, so that's a long-term relationship. You close your back door by having your hygienist be here for 13, 14 years, seeing them every 3, 4, 5, or 6 months. And the reason the DSOs don't scare me is because they can't get publicly traded, because they scare the hell out of Wall Street. But number 2, it's always the same thing. Well, why did you leave? Well, I went there, and a dentist, every time I go there, it's a different hygienist. I love my hygienist. Then it's a new one. It's always a new one. Every time I go there, it's a different hygienist. It's a different dentist. And it's like, they're trying to do the dentistry, but dentistry is invisible. You're selling your relationship. Because when I tell you that you have gum disease and have 2 cavities, who are they going to ask? Their mom? They have to trust me. And they're not going to trust me if every time they come in, there's a different hygienist, a different dentist, massive staff turnover. And, so pre-appoint, customers for life come from having employees for life. And thank you for being here. How long have you been here?
20 years.
20 years? It seems like 50, but it's only been 20. There's a special place in heaven for me putting up with her for 20 years. Or is that reverse?
That's reverse.
Okay. But, so if you want to keep customers for life, you're going to have to keep employees for life. And if you can't keep your employees, you're not going to keep your customers. And you got to have skin in the game. This is the hygiene department. This is the hygienist's responsibility to pre-appoint, not the assistants, receptionists, and it shouldn't come down to the office manager. If a hygienist can't pre-appoint her appointments, then the GM should go back onto the draft and try to find a better one that can. Sometimes you need a better player. Sometimes your existing players need more coaching. That's for you to figure out. No easy solutions there. HR. Would you say HR is the most difficult part of your job?
Absolutely. Yeah. Definitely. Yes.
And I think the reason it's so hard for her is because you're used to perfect, and then no other employee can just be perfect.
I know.
They're
what
all
can you do?
What can you do? But HR, when people call me from 3 states over and ask me if they should fire their assistant, I'm like, dude, could you make that call?
No.
No. I mean, because it's probably, what's the chance that it could be the dentist's fault?
That's very high.
Yeah. No, we always joke about this. What % of dentists do you say are crazy?
Well, that's a fair amount.
Oh, come on, Donna, you're politically correct, but what percent? If you had to make a percent, what would you?
I don't
I'm
know.
talking batshit crazy.
I don't know. You'd be a better judge of that than I would.
Okay. So, homie, just because you're a dentist, you always think I'm going to side with you. I'm not going to side with you. If I love you and respect you, I'm going to tell you the truth. And if I don't love you or respect you, or I'm trying to sell you something, I'll lie to you. I'm not here to make friends. HR is difficult. And here's what I've noticed in HR. I've seen a doctor have massive turnover for 30 years, and only one employee was there the whole time. And they were both the crazy people. You know, it was him and her. Batshit crazy. A lot of, what's that?
I can see that.
Yeah, so, what's the common denominator of all these terms? The first things you got to do is realize when I go in there and say, okay, you've been here 20 years and you have all these different employees every 3 to 5 years, who's hiring them? Well, if you work for the Diamondbacks, they'd say, well, we're going to find a better scout. When I came here, I did all my HR until Lori came along, and you and Stacy. The funniest one I ever seen is Lori, Stacy, and I think you were in on too, interviewed 36 people and then hired the first one you interviewed. I'll never forget Lori saying that she just was so upset that she spent all that time. I think it might have been, I don't know if it was a dental town or it was over here.
I don't think it was me, but I have a funny story about that too. It's like when women get married and they try on all these wedding dresses, right? And they go back and mostly it's the first one they try on.
Seriously?
A lot of the time.
Huh.
Yep.
Yeah.
Not all the time, but some of the time.
Yeah. Well, no one ever asked me for marriage advice, so I just I'll let that one slide. But the bottom line is it's people, time, and money. And if you get an A on people, you're gonna get an A. And if you get a C on people and an A on time and money, you're still gonna get a C. The people is everything. I don't care if it's the Diamondbacks, the Arizona Cardinals, the soccer team, or a dental office. And my gosh, if you are always stressed out by staff and you're always having staff turnover, my question is, then why the hell are you still in charge of HR? In fact, if I told Lori, Stacy, and you that now I was in charge of HR, how long would you laugh?
Long time.
Long time, yeah. So
you don't want to be in charge of HR. You have better things to do.
I don't know. I think the hardest thing is HR, but the bottom line is, dude, if you're not good at it, and it's very obvious you have all this staff turnover, if you're not good at something, either suck it up, buttercup, man up, and get good at it real quick by some advanced training books. I went back and got my MBA, or delegate it. And my gosh, I would rather go to a root canal implant bone grafting course 5 times before I'd go to some HR course and go over to the owner's manual, the HR. Who's the guy we use in Tucson? Paul Edwards with Cedar.
Pass it on.
Paul Edwards in Tucson. Yeah. But anyway, HR is tough, and pre-appointing is so important. And you got to have the right employees and the right policies so that everyone has skin on the game, so we all win together or we all lose together.